Hi everyone, Dr. Sylvestre here. I've created this workshop on hind limb amputations because I think it's an important procedure for most general practitioners to be able to perform on their patients. The hind limb amputation can be a life-saving surgery. So perhaps the patient has some neoplastic condition. You can save its life by removing the limb. Or maybe it suffered a severe trauma and surgical repair of that trauma is just not in the cards for those owners. Amputation can be an alternative form of treatment for these patients. I think one of the key factors to understand when performing a hind limb amputation is what level do you amputate the limb at? Normally there are three main amputation levels that we think about. There's the mid-femoral, which is the simplest, the most common, and in my opinion, the most aesthetically pleasing. There's the disarticulation amputation, and there's the hemi or semi-pelvectomy. Trust me, that last one is probably not one you want to get to know because it is a very difficult surgery, not utilized frequently. The mid-femoral amputation is by far the most common and will be used on most of the patients. However, if you have a patient with a distal femoral tumor, then a mid-femoral amputation would not be appropriate for that patient. Also, if you have a patient that has a fracture in the very proximal femur, maybe the neck, maybe capital physeal fracture, once again, a mid-femoral amputation is not the surgical procedure of choice for that patient. I think one of the important things to understand is you really don't need to identify every muscle as you isolate and transect it. This is not a study of anatomy, it's an amputation. But you do need to have a good plan. You need to get started. My recommendation is start by removing the biceps and then maybe the quadriceps group. Other than that, all you're doing is isolating and transecting all the muscles that come in your way. The adductor muscle, I think, takes a little bit more understanding. So take a moment to understand where the adductor is and have a look at the video and see how I remove it. There's always more than one way to do this. You're going to close by opposing the opposing muscles over that cut femur to create a nice cushion. And that's about it. Watch the videos in the workshop. Learn how to do a hind limb amputation, either a mid-femoral and or a disarticulation amputation. And let's get out there and help more pets.